There you go.
Hi, my name is Haley, and today I'm going to be demonstrating the insertion and removal of a male catheter. So the first thing I'm going to do is check my patient's chart and check the orders for the insertion of the catheter. Then I'm going to introduce myself to the patient and explain what I'm going to be doing and the reasons why. I'm going to make sure that the curtain's shut and the door to the room and provide my patient with privacy. I'm going to make sure that my patient is in a comfortable position, and I'm going to raise the bed to a comfortable working height. I'm then going to ask my patient if they have any allergies, specifically to iodine, because we will be using that in the procedure. So the next thing I'm going to do is I would perform hand hygiene, and I would put on just regular clean gloves, and I would expose my patient, and I would just clean the penis and the area that I'm going to be working on. So once that is done, I'll move on to the catheterization. So I'm going to open my sterile kit. Remove my sterile gloves. And then I'm going to start applying my drapes to my patient. I'm going to set the first one underneath my patient, resting on their thighs. And then this is just an extra sterile field that I would place on my patient's bed. And then I would use my fenestrated drape and insert it around my patient. So next I'm just going to take out the supplies that I'll need. Or actually, I'm going to put on my sterile gloves first. Okay, I'm going to discard. So next, I would take my iodine and saturate my cotton balls, and then discard of that. And then this is just hydrogen peroxide that I could also use for an extra cleaning agent. And then I would take my lube, and I would also pour that into my kit in a little spot and discard. And then I'm going to actually place this here. Remove my specimen container, and then remove the catheter bag. So at this point, I would attach my syringe to the port that I will be using later. Discard that. I would remove the catheter end and let it sit in my lube that I have in there. And then I'm going to take my tongs and I'm going to take the cotton ball. I'm going to make sure that I have a firm grip on the penis, and with the iodine saturated cotton balls with circular motions, I'm going to cover the penis around the urethra. Okay, I would use about 3. Okay. And then at this point, if I had a syringe filled with lubricating jelly, I would insert some of that into the tip of the penis, and then then I would grab the end of the catheter that's fully saturated with lubricating jelly, and I would tell my patient to bear down and just take deep breaths, and I would start slowly inserting the catheter. So I'm going to keep inserting until I see a flash of urine. for my patient, which is about there. Okay. I'm going to hold the catheter into place, and I'm going to inflate my balloon. So I'm going to start inflating my balloon slowly.
Bring the whole thing right there. That's all it is.
I don't know why my syringe is having so much resistance, but usually you would insert all of that into the balloon port, and then the balloon will inflate, and then you should have resistance there. And then I would clean up, put my patient back into a comfortable position at this time. But then comes the time for the removal. So I would have removed my sterile gloves from the prior procedure. And then for removal, I would perform hand hygiene. And then I would put on just regular gloves. And then same thing, I would describe the procedure to the patient, why we're removing the catheter. So for the removal, I would just start deflating the balloon. So usually I would let gravity take hold of the syringe, and it would fill back up on its own. I would just have my patient breathe, and then just remove my catheter, gather up all my supplies, discard, and then once again place my patient in a comfortable position, and then perform hand hygiene again.